When he has to engage with children, he engages through phone. When he has to sleep, he is in phone. That is the problem. The net, the digital natives, we call them, children born after the invention of net, are different. Their brains are different. Their mind is different. In fact, series of books are coming now. The change in brain and mind to these digital natives. We are digital immigrants. It came to us later on, and that's why we have a conflict. The digital children are entirely different. Their behavior is different. I think, sir, you talk how many problems you see in children due to net. I wouldn't call it misuse, overuse, but the problems they get, they are entirely different.
0 to 18 years of age, that's the most vulnerable period of our lives. We see children in even 2 months, 4 months, 6 months who just concentrate on their phones. So the main malice that we are seeing now with this phone, the positive things are there, is that their minds are directly affected. They have started losing their eye-to-eye contact. Their parents are on two sides and the phone is just in front of them. They think that their parents are all like two electric poles and their parents are now their phones. This is affecting their psyche. We see a lot of children now, what we call as attention deficit hyperactivity disorders. We see a lot of them. We see hyperactivity in these children. We see these children tossing their heads, and even if there is a gathering, we hardly see the children interact with them. So that is one, they have lost their social contact, is that already gone. That is one aspect of it. Second is the physical. I don't see any organ of the body which is not affected. Every organ of the body is affected with this. Now, what would be the interventions? How do we intervene in such a situation? The use is there, we cannot take it out from our lives. As Nasir said, it's absolutely right. But one is use and other is overuse and misuse. That is where we have to draw the lines. Now when children come and their parents come, their parents always start abusing their children in front. Say that he is using the phone and please tell him something. Now how can we correct this? The correction here would be to have parental de-addiction rather than the children being affected. As Zafar Saab rightly said, that what I do, I smoke in front of my child and then they tell him don't smoke. How is it possible? So family interventions are there which need to be done. So family-based interventions can help in removing some of these malices. Second is in schools. Now in schools, we have become internet learners. COVID-19 has completely changed our lives. So we can bring it back because this learning which you are seeing, children seeing these phones and then going on with these videos like Cocomelon and other things, their parents think that they have become great learners, but it is a passive way of learning which hardly goes in the mind for a few days, months, and then you lose it. Then there is another internet gaming disorder, which is now a term used by American Psychiatric Society, where people are stuck to these games. Is it necessary? It's not necessary. So how do we, I think schools are institutions where we can introduce it, where there can be strict instructions for that. So that is the part where we can, schools can play a very important role. We talk about drug addiction. I think it is much more than that. So we have to tackle this addiction as we are tackling the drug addiction. So I think interventions are there. We have to ponder over it, we have to think over it and find solutions. Solutions will always be there to the man-made problems which we have created ourselves. So let us use this for our knowledge, not for purposes. And parental addiction can be controlled rather than addiction by children.